First of all, I'd like to welcome the news that the legal difficulties in arriving at the contract have been resolved between the IMO and the Department of Health, and this is something certainly that the general practitioners would have raised with many deputies during the last number of months, both individually and collectively, at a meeting that I would have attended in Galway at the Ardlawn Hotel. So I certainly welcome that the difficulties that were arising in that regard can be resolved. Obviously, the medical card issues have arisen during the course of the local and European elections, and indeed they've arisen over the course, particularly of the last 6 months. And I think there's a lack of discussion, if you like, and reasoned debate on the cost of the medical card system and how the system can be substantially funded. I think there's also I suppose a lack of honesty about the figures. I mean, there are certainly of nearly 2 million medical and GP cards in circulation at the moment, nearly 43% of the country. Now, unfortunately, there are case-by-case basis that medical cards have been withdrawn, I believe, incorrectly and wrongly, and unfortunately these have come through the system, and that is very much regrettable. Many constituents with medical conditions deserving of medical cards are without them because of the financial focus of the legislation. And I particularly talk about cases where you would have family members with Down syndrome or autism or other conditions where they would have had a medical card for a number of years and suddenly find that because of the financial threshold, whether it's happened because of the centralisation of the system, which took place in Dublin, where they would have had a discretionary card based on a child's condition, that card is suddenly withdrawn. And that is of grave concern. And one set of parents, and I won't name them, but one set of parents who lost a medical card for their daughter who had Down syndrome. And their view was you can, impose whatever tax you like, you pay income tax, they pay your property tax, they pay their water taxes. But in terms of the medical card was for their daughter because she was different, because she was special, because she would always have the condition that she has, and therefore she was deserving of the medical card in her own right. And that was the premise of their argument, and something that is very hard and very difficult to disagree with. And I think that whole area needs to be looked at in the review of the legislation, or any further review of the legislation, and whether new legislation needs to be brought in, well, so be it. I think that needs to be looked at. Also expressed disappointment with the medical card plan for persons under the long-term illness scheme. I accept that this was legislatively difficult to do, but it was something that was committed, and I'm sorry that hasn't been brought to fruition. The Health General Practitioner Services Bill 2014 is to provide a legislative framework for the provision of make GP care free for all under 6s. And this is the first step in the phased introduction of the universal free GP care. Overall, 420,000 children will have free GP care. 181,000 who already have a medical card or GP card will be joined by a further 240,000 who will gain entitlement under this bill. GP visits are related to price. Research shows that free GP access results in more frequent visits to the GPs. However, common sense dictates that the sooner illnesses is treated, and the lower the long-term costs both to the patient and for the health system. Budget 2014 set aside 37 million to meet the costs of this new policy. And overall, the health budget of 13.66 billion in 2014. And as I said earlier, some over 40% of the population has a medical card. I would agree that children are a priority health group. However, a vast majority of children, thankfully, do not require ongoing GP care and attention. There are many adults with long-term or chronic illnesses who benefit from free GP care right now. And I think Ireland is the only EU country that does not offer universal primary care cover. Most OECD countries have free or heavily subsidised primary health care. The IMO, St Vincent de Paul and others have criticised the new direction of the under 6s because they believe that it's moving away from the current general model our general medical scheme objective of assisting the most vulnerable and less well off in our society to obtain primary medical care. However, the GMS will continue to exist. Currently, those with medical cards are often better able to access primary care than many of those on the middle incomes due to the costs involved. It is important to highlight that GPs have contributed to the stabilising and repairing of our economy. GPs have experienced a reduction in the fees paid under the GMS. In 2008, GPs received €353 per patient per year. In 2012, that was reduced to 243, and a further reduction was implemented in July 2013. However, the overall amount paid by the government to GPs under the GMS remains at 450 million, approximately due to the extra 60,000 or 600,000 people who have become eligible for medical or GP visit cards. The GMS system has been maintained largely due to the cooperation of GPs and the health service, and it's important to recognise that the economic crisis simply meant that the GMS should have been funded could not have been funded at pre-crisis levels. And again, I would like to say that a very welcome news regarding the agreement. This has been something that has been discussed with doctors over a long period of time. There was a lot of concern about this move, a lot of concern that they were not able to negotiate their own contracts. There was a lot of concern regarding the original draft contract and certain aspects of that contract. So it's certainly very welcome and very positive that this change has taken place. And I hope now they can go and enter into these negotiations and sign this contract up. And obviously, this legislation will allow that contract to come into being and allow delivery of a key component of the universal health care for our under-6s. I would like to reiterate the point also regarding those who suffer from conditions such as Down syndrome or autism. And I do really feel that what we as a government have been doing in terms of withdrawing medical cards on financial basis for those kids, and at the same time introducing legislation to give medical cards to under-6s with no regard to the parents' finances. There is a very serious anomaly there, and one that needs to be addressed. And the Minister stated that it's not possible under the existing legislation. Fortunately for those kids up to now who had the medical cards, they had them under the existing legislation. They had them by discretion, they had them by default, they had them based on community welfare officers knowing the real details, getting to know the people, getting to know the case, getting to know the fact that these children have a condition. So it's important that we relook at that. I think that we have I suppose we have been at fault in what we have done in certain cases like this. And it's very difficult to stand up here and support a model like this. I fully support it, and at the same time try to defend the removal of medical cards for children with autism or Down syndrome based on their parents' income. There's a dichotomy between the two, what we are doing and what we are planning to do now. So I would hope that the Minister would be able to look at that whole area to introduce legislation, if possible, if it doesn't fall under the 1970 Health Act, to introduce new legislation to allow for a different criteria, to allow for a different type of medical card based on existing conditions such as those that I've outlined. And I certainly hope that, and I think it's been indicated or certainly suggested by the Minister of the Taoiseach, that this can be looked at very soon. And I certainly hope that it can be brought in, because there is a need, there is a demand, and we've, I think, very much lost touch with those families who have suffered from the withdrawal of the medical cards in those cases, and I certainly hope it can be done. Again, I would note that the acceptance of a scheme like this by the general practitioners is hugely important. Their role have a huge role, obviously, in our healthcare system. It is a healthcare system of which there is very little complaint. In fact, probably no complaint. We know that there's many complaints in different sectors of the health sector, but the GP sector is not one of those. And I certainly hope that they can get this the contract signed up now that the IMO and the Department of Health have successfully negotiated their deal, that the contract can be signed as soon as possible, and that we can see this legislation being enacted and rolled out to provide that free GP care for the under-6s as committed by this government in the programme from government, and certainly we look forward to that. And I think, there may be extra finances needed, but that will be a decision for the Minister as the deal today has stipulated. There cannot be any negotiation of the fees element of the contract. Thank you.